Hello everybody. Today we talk about a very common condition among the young adult males, that is the male boob reduction or the gynecomastia procedure or the male breast reduction surgery. It is a very common condition to cause depression among the young adult males. But now we all know that this is a treatable condition and can be easily treated by a simple surgery which have marvelous effect in boosting your lost confidence. Hello everyone, I'm Dr. Ashish Khare, consultant plastic surgeon at Kalosa Aesthetics Studio and practicing in Delhi and Gurgaon. I've experience of operating more than 3,000 gynecomastia cases under local anesthesia as well as under general anesthesia with stupendous results. So stay along with us to understand the gynecomastia procedure in detail. You can subscribe our channel or click the bell icon for further plastic surgery videos. So how we define gynecomastia? Gynecomastia is abnormal collection of fat as well as glandular tissue below the nipple areolar complex. This abnormal bulge of tissue gives an feeling of low confidence and embarrassment to many of the young adult males. Now let's discuss what are the causes of the gynecomastia. Hormonal imbalances during the puberty, anabolic steroid intake. This is the most common cause among the bodybuilders. Alcohol, obesity, kidney failure, testicular tumors, and idiopathic. Idiopathic is the most common cause of gynecomastia seen among the young adult males. What is the treatment of gynecomastia? Treatment of gynecomastia is always surgical. There are no any other maneuvers or medicines to treat gynecomastia. And as I always say, gynecomastia should always be operated by a plastic surgeon. What you expect at the time of initial consultation. When you come and consult me, I will assess whether you have a gynecomastia, your grades of gynecomastia, the amount of fat, and the glandular content. Is the gland hard or it's friable or soft? It has to be assessed. The position of the nipples and any axillary extension of the fat or axillary folds of fat need to be assessed. On the day of consultation, you have to assess with your doctor that whether you have to go for the surgery under local anesthesia or the awake anesthesia or the general anesthesia. After you have decided that you have to go for the surgery for the gynecomastia, the initial basic investigations are advised for your general health checkup and a COVID RT-PCR is also advised. You have to stop smoking and alcohol consumption should be stopped 5 to 7 days prior to surgery. Blood thinners are also advised if you are taking to stop 5 to 7 days prior to surgery. So today we have this young chap, he's 25 years with the same common problem, that is the gynecomastia. He's having a grade 3 gynecomastia with the puffy nipples. He has main complaints of increase in the volume of chest. He tried all sort of exercises, but he's not able to get rid of these chest fat. So what we are planning in this? On initial assessment, what we are looking for it's that how is the fat? What's the distribution of fat? Well, it's confined to the nipples or it's going up till the middle third of the clavicle. It's involving the both sides, it's a bilateral, and we have to see where's the position of the nipple, how is the nipple size, it's normal or it's puffy. How is the gland actually? Yeah, he's having a gland as well and having a puffy nipples. The glands are non-tender. So basically, at the initial consultation, we look for the fat, the glandular tissue, whether the gland needs to be excised and the position of the nipples. Now, at the time of initial consultation, it has to be decided between the surgeon and the patient whether this has to be operated under local anesthesia or under general anesthesia. It all depends upon the pain threshold, the amount of the gland content, and the compatibility of the surgeon with the patient. This type of gynecomastia, that is a grade 2, can be easily operated under local or the awake anesthesia or the tumescent anesthesia. If the patient has hard glandular tissue beneath the nipple areolar complex and he is afraid of pain, a small amount of pain, he should go for the procedure under general anesthesia. And make sure the patient should ask all his queries about the procedure, for the management, and what are the post-op precautions before going to the surgery with the surgeon. The patient is called empty stomach in the morning of the surgery if the surgery is planned under general anesthesia. And if we are planning the surgery under local anesthesia, the patient can have light breakfast early in the morning on the day of surgery. An informed consent is taken from the patient and a test dose for local anesthesia is done. The most important step, that is the marking, is required to be done prior to the surgery. The areas we need to suction along with the small periareolar approach to remove the glandular tissue. Here, as you can see, the fat is confined from the inframammary fold to the middle third of the chest. It's extending laterally as well and medially up to the sternum. So this all area, we need to do the liposuction and infiltration in all this area and extending up to the lateral as well, so that suctioning out the lateral fat as well. The same thing happens in the other side. The fat is extending from the inframammary fold up to the lateral border of the sternum and going up to the middle third of the chest. Here also, the fat is going into the lateral compartments of the chest wall, and we are trying to suction out from the lateral compartment of the chest wall as well. A small periareolar approach just is about a 2 or 3 centimeter of insertion to removing the glandular tissue beneath the nipple areolar complex. We infiltrate the area with an infiltration fluid. The incision site is through the periareolar approach or to the lateral side of the chest wall, which is hidden and not seen actually. Once the infiltration to the whole area has been done, then we do the VASER. We wait for some time for 5 to 10 minutes, followed by the VASER. VASER helps in emulsification of fat. Basically, the gynecomastia fat is too dense, very dense as compared to that of the abdomen. So, VASER helps in better melting, emulsifying of the gynecomastia fat. So, it eases the suction procedure. Once the VASER is done, we follow it by the suction, the routine suction. Once the suction is done, we appreciate the NAC, no effect on the hard glands. So that we have to take out through a small periareolar approach with a small 2 to 3 centimeter of incision. We take out the glands and gives a better contour and shape to the bilateral chest wall. The glands are sent for histopathological examination and the wound is closed in 2 layers, the inner one with a white absorbable sutures and the outside with a small nylon sutures. The sutures are removed after 2 weeks post-surgery. Post-op precautions at home. Gynecomastia is a daycare surgery. The patients are advised and discharged on the very same day. The precautions which have to be followed in the home premises are as follows. You have to take a course of antibiotics and painkillers. Your hand should not be elevated above your head. You are advised to lie supine on the bed with the head elevated. You have to be actively mobilized. The more you mobilize, the more early the recovery. Post-op follow-up. After the day of surgery, the patients are called 48 hours post-surgery. The dressing, compression dressing I would say, is removed. The patient can see their results. There's a dramatic change in the result and patient can appreciate the results. The dressing is done and the patients are advised to wear the pressure garment for 4 to 6 weeks. Patients are called after 7 to 10 days for removal of the stitches if required. I'm stressing on the pressure garment. Pressure garments are the integral part of a gynecomastia procedure. They give a constant pressure so as to get a better shape and contour in the post-operative period. At Kalosa, we make sure that you get a pressure garment of a good quality and customized to your individual size. Further recovery instructions. The pain post-gynecomastia surgery usually subsides in 3 to 5 days. You can wear a pressure garment for at least 4 to 6 weeks. You can resume your office activities after 3 to 5 days. You can start walking the very day of the surgery. Start your lower abdomen exercises by 3 weeks and the upper chest exercises by 4 to 6 weeks. To conclude, gynecomastia is a simple short surgery, but goes a long way in boosting up your confidence and helping you bounce back in life. You will definitely love your decision to undergo this surgery. Hope this video must have cleared all your doubts related to the gynecomastia's procedure. To know more about the gynecomastia, do visit our website www.kalosa.in or subscribe our channel or click on the bell icon for more plastic surgery videos or reviews. Thank you.